Thank you for listening to Depictions Media Radio.
Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. We wanted today, first of all, to say I'm honored to be here on the territory of the Musqueam, of the Squamish, of the Tsleil-Waututh First Nations. We're honored to be here on their lands today. I wanted to provide everyone with an update on yesterday's Walk-In Wednesday, which was, by all accounts, everywhere in BC, a very successful event. Yesterday, clinics in clinics across the province, 33,277 shots were delivered, which is a significant number, up from previous days, but importantly, and this represents, I think, the effort to assist people in walking in to get their shots and focusing on first doses. 16,505 of those were walk-ins, significantly more, several times more than we usually get. The rest were appointments. That more than 80% of the 20,000 doses set aside for walk-ins were used, which we were very happy with. And of the walk-ins, 37.6%, or 6,130, were first doses. This, combined with the first doses that were done by appointment, made it one of the most significant days since really before Canada Day, our most significant day for first doses in some time. So it was a very good day, and for those of us, for Provincial Health Officer and Health Minister in a pandemic, yesterday was a pretty good day, at least as good as Thanksgiving in any event, Walk-In Wednesday. And we were excited to see around the province the effect of that, and you see that both in the numbers and in the response, especially amongst young people in many regions. In Fraser Health, they delivered 2,100 more doses than they had the day before, and heard about the convenience people had from being able to walk in to get their appointments and get their first shots in particular. Clinics in North Vancouver and Whistler were much busier than normal, while Squamish saw a great uptake in walk-ins. Interior Health delivered more vaccines yesterday to walk-ins than their regular scheduled appointments, and it was a very successful day and an important day in Interior Health. And on Vancouver Island, clinics in Comox, Cowichan, and Alberni saw a great uptick for walk-ins in people under 30 years of age. Yesterday was, therefore, a success, but there's obviously more work to do. As of today, we've done, in terms of vaccinations over the age of 18 in adults, 82.6% of adults are vaccinated, 70.6% have received both doses of a COVID-19 vaccine. Over the age of 12, those numbers are 81.7% and 68.4%. That's 6,965,062 doses delivered by the vaccination efforts in BC, by Vax for BC in BC, since we began our vaccination campaign in December. And so I encourage people who didn't get vaccinated yesterday or on previous days or need their second dose to do it today. They can register and book vaccine appointments. That's the best option to secure your dose. But for first doses, all of our clinics offer the possibility of walking in whenever they are open in BC, making getting vaccinated in BC easier than ever before. Today, for example, in Vancouver Coastal Health, they're at Kitts Beach between 12 p.m. now and 6 p.m., giving doses there. In Fraser Health at the BC Ferry Terminal in Delta, along in our work that we're doing with TransLink. On August 7th, we'll be in Surrey at the Fiji Islamic Center. Today there's a special vaccine appointments at the Quarney Community Center. Obviously, we're continuing to do with our work with the Downtown Business Association in Kelowna. We're doing the ongoing drop-in appointments at the Kelowna Yacht Club this afternoon. I encourage everybody in Kelowna who's not been vaccinated to go there today as well. We're at the Totem Mall in Fort St. John this afternoon, available for drop-in appointments there, and in Fort Nelson today, all through this afternoon to get your appointments. In fact, all over BC. The message is that the message from the data, the message from what we're seeing is that now is the time, if you have not received your first dose, or you're able to get your second dose, you're eligible to get your second dose, now is the time to book your appointment or drop in to one of our centers around British Columbia. You can go to our website or just Google Vax for BC, and you can find the place to go and go. Yesterday was a successful day. I want to thank everyone, all of our healthcare teams across BC, all of our community partners who are part of this, all of the people working and volunteering at our vaccination centers, and all of you, people in BC, for continuing to get vaccinated at rates really as high as anywhere else in the world. This is the path forward, and we have to continue to press and push every single day. Today, if you haven't been vaccinated, is the best day to get vaccinated, and we need to do it. The effort yesterday will continue to be repeated day after day as we find different opportunities to reach people and give them the opportunity to be vaccinated. But there is an opportunity today. It's important to do, and as we see significantly cases amongst unvaccinated people in our province, the need to get vaccinated is stronger and stronger every day. And with that, I'm honored to introduce Dr. Bonnie Henry.
Thank you very much, and good afternoon. And I am just going to echo the Minister's comments in thanking each and every one of the thousands of people who chose to be vaccinated yesterday. You're doing your part for all of us to get through this pandemic. I'd also like to thank the many healthcare workers, the vaccination clinic staff, and countless others who worked all across this province to make yesterday the success it was. And I heard many stories. I heard stories from people who were concerned about going because they had concerns about getting needles. They were afraid that it was going to be too loud and noisy. And they were all positive stories about how our team was able to answer their questions, how they were able to get the vaccine easily and quickly and calmly, and people who needed to lie down to get their shot were able to do that too. And I just want to reassure everybody, if you have concerns, if you have questions, drop into the clinic. You can talk to our immunizers who've now had the experience of immunizing millions of people with this vaccines that we have available here in BC. And I want to reassure people again that we have been following all of the data on safety and effectiveness, and we can be confident that these vaccines are saving lives and making a difference. As we've been saying for many months, it's thanks to vaccines that we've been able to safely enjoy so much of what we have so far in this summer, and of course, to be able to see each other again. Even though Walk-in Wednesday has finished, our work to offer vaccines to every person in BC over the age of 12 will continue, and in the weeks and months ahead, there will continue to be quick and easy ways for you to access your vaccine across the province. So I encourage people to talk to those who've been immunized, to talk with their family and friends, to talk with your faith leaders about the importance and how you can get your vaccine. As we look forward to fall, though, we all need to be mindful that this virus is not gone, and we've seen that with the increase in cases that we've seen in the last few days and few weeks, particularly in the Central Okanagan, where we see again that this virus can take off easily in people who are not protected. It's mostly young people, many who have not yet had the opportunity. There's many opportunities to be immunized, but now is your chance, and particularly as we head back to school, back to university come September, it's going to be more and more important for all of us to be protected so that we can manage this pandemic and move on with our lives. So now is the time. If you're a healthcare worker, if you're a student, if you work in the hospitality industry, we know how challenging it has been for you, and we have seen that this virus can transmit very easily in those high contact environments that you're in. Protect yourself and protect those around you, and that is how we are going to get through this pandemic. I do want to say that we are right now experiencing a surge, as you know, of cases, primarily in younger people between the ages of 20 and 40, and 95% across the province of people who are infected right now are unimmunized. Watching what happens in the next few weeks, and the importance, of course, of everybody who is able to be immunized in those settings to be immunized. And now's the time to do that so that people are fully vaccinated as we move into the school season in September.
Our next next question today is from Moira Witten, the Tyee.
Hi, good afternoon. Thank you for taking my question. We know that vaccination prevents serious illness and hospitalization, but recent data is showing that the severity of the Delta variant to cause serious illness could have a compensatory effect and cause hospitalization rates similar to the proportion that we saw in the previous waves of the pandemic. What level of hospitalized cases would cause a halt or a regression in the stages of reopening that you've laid out? And is there a threshold at which you would make the decision to begin canceling surgeries or otherwise freeing up hospital space?
Yeah, so these are all things that are very much, again, in flux. The epidemiology is challenging to tease apart in terms of increased virulence or not from Delta. As we know, it's more transmissible, but it also is being transmitted in groups of people who are unvaccinated. So it's really hard to tease out if it actually does cause more severe illness, and we've seen this with every single variant that's arisen. It takes time to work that epidemiology out, and you'll recall the Alpha variant, when it initially arose in the UK, there was concern that it was causing more severe illness. Same with Gamma, the P1, same with Delta. So we are obviously watching that carefully, and our planning around hospitalizations goes back to the same type of planning that we've been doing all along through the pandemic. So we know how many beds we have, how many surge capacity beds we have for COVID. And the other factor that's in the mix right now is that we've seen, and we've talked about this in the last few weeks, we've also seen an increase in need for hospitalization and ICU care for non-COVID related issues that people may have been putting off for some time because of the pandemic, or that have been exacerbated through this last period of time. So those are all part of the modeling that we do on an ongoing basis to understand our capacity in the healthcare system. We're not at a place now where we are seeing that. We've seen a slight increase in hospitalization, but again, primarily in unvaccinated people in their 40s and 50s. So the younger people that are most commonly being infected right now with the Delta variant are not ending up in hospital for the most part. We're seeing a decoupling of the cases and hospitalizations. Having said that, those are things that we'll watch because we know it is a lag indicator as we move on into the fall season.
Did you have a follow-up question?
I do, thank you. You mentioned earlier that many young people, especially teens, are now just getting the opportunity to have their second dose or to have it after the province entered stage 3 on July 1st. Does this subsequent surge in cases, which many experts say definitively signals the beginning of a fourth wave, mean that BC's reopening went ahead too soon? And are you planning any major changes of course with further health measures being reinstated?
Yeah, so the short answer is no. No to both of those questions. We go back to the basic principles of how we've been managing this pandemic. The things that we're trying to do is prevent morbidity and mortality, so sickness and death, to prevent overwhelming of our health care system, because we know that affects not only people with COVID, but people with non-COVID illnesses that need health care. And thirdly, to reduce and minimize societal disruption as much as possible. There are downside impacts on all of us from some of the measures that were in place, even the measures that meant that we couldn't visit with family and friends. Those are important things, important considerations for us as we move through into recovering from this. There's no dichotomy between the economy and our health. They both go together. We need people working. We need people in school. We need to have societal cohesion come back. And immunization gives us that ability to do that. It's not perfect, and we always knew we would see increased numbers of cases, particularly in people who are unvaccinated. And, I don't I think if we look at models, if we look at all of the models that have been out there since the very beginning, they give scenarios that help us understand which are the important considerations. And the models that we are looking at right now tell us unequivocally the important indicators are even a small increase in immunization across the age groups makes a massive difference in whether we see a wave that is big or something that is more of a ripple. And that's why we're focusing on the important things that we know make a difference right now, and that is being immunized. That's our tool right now that is working to suppress cases and to manage outbreaks.
We have time for one more question. Our last question today is from Mary Brooks, Island Social Trends. Please go ahead.
Hi, Dr. Henry and Minister Dix. So I'm looking at the over 7,000 people who got their shots yesterday, which is great. A lot of them probably first shots. And a lot of those people would be young adults, presumably, since they were kind of left to last in the queue. And so if they're going back to campus this fall, they're not eligible if the interval is still 8 weeks between first and second dose for getting their second dose until the beginning of October now. So how do the campuses, how are they expected to handle having a partially vaccinated student population? And also, when the students do want to get their second shot, do they have to go through the registry? Is that how it's going to work now, and they wait for the call? Or do they just show up at another clinic 8 weeks from now on their own volition?
Yeah, so there's a couple of things in that question that we can unpack. Part of them is, we are looking at what is the best interval for supporting going back to school in the fall, and we're modeling how we can do that. As you may know, we've talked about a few times, we've had a huge number of people who have been eligible for their second dose in the last 3 weeks. And so we're coming over that curve now. And so that gives us a little bit more flexibility with the amount of vaccine that we have now to adjust that interval if we need to, particularly for hotspots. For example, in the Okanagan, the Central Okanagan, we're moving up the eligibility, have moved up the eligibility so people can get it at 28 days or more after their first shot. That means that we can get more people fully protected as we know that the virus is circulating in those communities. So we're looking at that across the province, and we'll be making some decisions about that in the next few days about where and who should get the vaccine sooner in the next little while for a variety of different reasons, and that will help us as we're going into September and in the end of August as people are arriving to go to university. In terms of how people are going to be able to access it, those are things that we've been working on as well with the post-secondary institutions, and especially for the larger ones, we need to have vaccine available at student health services within reach of students' access very easily on campus, and we're working on those as well.
And Mary, did you have a follow-up question?
Yes, just briefly then on shots that have a shortened interval, will go, regardless of what age the person is who gets that, is there more of a concern that a shorter interval shot is ultimately less protective in terms of vaccination than if they've waited what you originally had hoped would be 11 weeks as the ideal?
Yeah, so that was another really great question, that's something I've been consumed with for a number of months, as you probably know. What is the optimal interval? We still don't know that for sure, but there is increasing evidence that having at least 6, 8, 10 weeks between doses, if you're able, probably gives stronger and longer lasting protection. So for the vast majority of people in BC, that interval has been at least 7 weeks or longer, and I think that is one of the reasons why we're seeing such good protection in settings like long-term care. But it is a balancing and a bit of and some would say a race in some ways, between protecting people with 2 doses when there's a lot of virus circulating in the community, and getting that extra bit of cell-mediated protection that you probably get if you extend the interval a bit longer. So it is different for different people in different parts of the province. Right now in the Central Okanagan, it's much more important that we get most people with the second dose as soon as possible, because we have a lot of the virus circulating, relatively lot circulating right now. But for most of us in areas where it's not circulating, it's better to wait a little bit longer if you can. So those are all the considerations that we've been working through with our BC Immunization Committee, and we'll have some more information about that as we analyze what's happened this week and as we get closer to the fall. Did you want to say that?
And that's all the time we have for today. Thank you
Thank you
everyone
very
for
much.
joining.
Thank you for listening today, and thank you for supporting us with our sponsors. Please go to depictions.media for more information, and click on our contact link and let us know how we can help bring your story and help bring us to a better world. This show has been produced by Depictions Media. Please contact us at depictions.media for more information.